CBT for anxiety disorders. Part B. Types of anxiety disorders. ICD-10. Phobias. Agoraphobia and social. Panic disorder. Generalized anxiety disorder. Obsessive-compulsive disorder. Somatoform disorders. Post-traumatic stress disorder. Adjustment disorders. Conversion disorders. Examples of anxiety-related negative automatic thoughts. I am having a breakdown. I will be overwhelmed. I will go mad. I will be unable to perform at work. I will be condemned to a life of anxiety. I am on the downward slide to disaster. I will become sick. I have zero confidence. I am weak. I am doomed forever. I am out of control. Anxiety is a response to a threat. Our bodies and minds are designed to deal with danger and threats. Survival is a common task for all living creatures. Over thousands of years we have evolved ways of detecting and reacting to threats. Humans are motivated to get safe and limit potential damage or harm. Responses that can be activated quickly and automatically when needed include physiological systems and physical reactions, heightened emotions, behaviors such as fight, flight, freeze, submit, cognitive processes, I better be safe rather than sorry. People experience anxiety disorders when they think situations are more dangerous than they really are. The goal of therapy is to help the person consider alternative, less frightening explanations. Then help them to gather their own evidence that supports these new, less frightening explanations. Needs to be individualized. The first stage of treatment is to help people identify the particular situations in which they feel anxious. Identify the thoughts, behaviors, and physical symptoms that happen in these situations. This forms the basis for understanding what the patient is experiencing and also forms the basis for diagnosis. Think about a personal feared situation that you would like to deal with. What thoughts, images, memories might go through your head? How you might feel physically? How you might act, or how you might want to act if you were asked to go into that situation in 5 minutes' time? What physical symptoms do we experience when we are anxious or perceive a threat? Heart beating fast, breathing fast, sweaty palms, feeling hot, butterflies, nausea, needing to go to the toilet, shaking, feeling dizzy or faint, unsteady on your feet, tightness in the throat, numbness or tingling in the fingers, lips and toes. Anxiety physical response to threat. We respond to threat with the adrenaline fight-flight response. Unfortunately, in the modern world, the threats we are facing are not physical. Often the fight-flight response is not helpful to us in responding to the threats we experience. In anxiety disorders, our bodies are reacting in a normal way to a perceived threat. What do you do when you're faced with a situation that involves a threat? Face it with anxiety, fight, flight, avoid, look for help. Anxiety is a normal response to threat. The CBT therapist is interested in the specifics of what people think, feel physically and what they do in situations in which they feel anxious. This helps to understand the threat that people are perceiving, and their reactions to it. In anxiety disorders, people get stuck in negative irrational ways of thinking. For instance, overestimating risk, misinterpreting situations or events as dangerous. CBT treatment for anxiety. Gain an understanding of the client's anxiety, their thoughts, physical reactions and behaviors. Normalizing the anxiety for the client without patronizing them. Providing education about anxiety and the specific disorder. Psychoeducation. allowing people to experience anxiety and learn that it peaks and then starts to fade. Creating alternative explanations for threats. Developing a therapeutic relationship in which people feel safe enough to put themselves in feared situations, and try out behavioral experiment. This will allow them to develop their own evidence for alternative explanations. Allow people to work out what the threat is. What is the key cognition? It may involve working out what the basis for this cognition is. Examine early experiences that have led to this cognition. Treatment techniques from behavioral therapy. Graded, prolonged and repeated. Patients develop their own hierarchy. Comes from behavioral therapy. Not interested in cognition. Exposed to feared situation repeatedly, and you will become less anxious because of habituation. Behavioral experiments. Trying out new behaviors to test out cognitions, predictions. Aim is cognitive change. Allowing patient to find their own evidence to demonstrate that the feared catastrophe does not happen every time. May involve a graded hierarchy but does not have to. Change can be faster.